All right, in this chapter, we're going to be looking at resistance training, aerobic training, physical conditioning for older individuals. So we're going to be looking at various aspects and benefits for older individuals exercising, and we're going to kind of start out by just going through the different systems. Then we're going to look at some exercise recommendations later on. So looking at the muscular system, so a couple things to note. So the skeletal muscle obviously plays a role in movement, independence, weight maintenance, and overall health. After 30 years old, muscle mass does start to decline without exercise. So that could lead to a lot of health-related problems later on and really decrease quality of life. Now, if somebody is active, obviously they look to maintain, if not possibly look to gain some of that lean tissue. So for people who do not perform resistance training, again, you see here the rate of muscle tissue loss, and then it declines even more at 50 and 60. So, and again, there's issues with this because muscle mass is so metabolically active. Okay, so muscle mass allows you to burn more calories, again, maintains your metabolism. You know, your muscle loss results in a decline in metabolic rate, which then that's going to lead to increases in body weight and contribute possibly to metabolic disease. In particular, there's going to be increases in that intra-abdominal fat, which we know is associated with metabolic syndrome. Plus, there's a better chance for cardiovascular disease since muscle tissue helps with glucose metabolism and triglyceride disposal. So all of the things that predispose people to a lot of, cardiovascular issues, metabolic issues as they get older is related to a loss in lean tissue. Again, the decline in muscle with age is termed sarcopenia, and sarcopenia is also connected with osteopenia or an age-related loss in bone tissue. So as individuals are losing bone mass, or as individuals are losing muscle mass, they're also going to lose bone mass. So bone mass can decrease as much as 30% each decade in conjunction with losses in muscle mass. So again, these two things go hand in hand, and performing resistance training later on in life can certainly not only not allow this to happen, but also can also assist with bone mass and also assist with development of lean tissue. So when we look at the types of muscles, so fast twitch fibers are actually lost at a much greater rate than slow twitch. So again, if you don't recall your physiology with slow twitch and fast twitch, so if you're saying to yourself, well, I don't know all the differences between slow twitch and fast twitch, please go back and review that because that's going to come up. But basically, when you're looking at your fast twitch, that's going to cause a decrease in muscle power. Remember, one of the things associated with fast twitch muscle fibers is that strength and power is more of the benefit of your type 2 fibers, whereas type 1 fibers are more for endurance abilities. So your muscle endurance, more closely associated with type 1, decreases at a slower rate. So what this tells you is maintaining muscle strength is a harder thing to do as you get older than even endurance is. Another thing that we tend to forget about as well is just, again, some of the body chemistry issues associated with loss in muscle mass. Myokines are a hormone-like substance that actually have endocrine effects on other body organs, and that actually could affect and be protective. The circulation of myokines can be protective against several chronic diseases. So having, again, better fitness related to strength and muscle allows for that. Again, we kind of already talked about like muscle loss being associated with fat gain because of the metabolic effects, and then the increase in intra-abdominal fat, which we know is an independent risk factor for diabetes. The other thing with muscle loss is there's an increased risk of falling. Studies have shown that people with, older people with stronger lower bodies tend to live longer. And the reason for that is the reduced risk of falling, reduced hip fractures. We know that for a lot of older individuals fracturing their hip, there's a high morbidity associated with that. So There's things that you can, again, kind of prevent through being stronger that's very important that we tend to miss out on. So, and again, we're going to talk about the benefit of, obviously, cardiovascular endurance and kind of what that means. But the reason why it's not to say that resistance training is necessarily more important. It just gets highlighted here a little bit more just because of the fact that many people just don't do it for one reason or another, which, we'll also talk about that later as well. So looking at the cardiorespiratory system, so age affects the cardiorespiratory system as well. So again, some of these terms, make sure you know what they mean. Maximal stroke volume, heart rate, cardiac output is going to decrease progressively throughout the aging process, which we know that, again, maintaining some sort of cardiovascular fitness will prevent that from occurring. So the increases in ventricular wall thickness and stiffness of the arterial walls and lung tissue are going to further contribute to an overall decline in aerobic capacity. And dyslipidemia and hypertension, again, being more common in older individuals. Again, exercise intervention, cardiorespiratory wise, and again, even resistance training wise, is going to have a positive effect on these adverse changes. So we do start to see, again, with aging, much like with many of the other systems of the body, cardiorespiratory system is going to be obviously no different. And we obviously already know, we've talked at length when we discuss the cardiovascular and the respiratory system, some of these issues. And again, this form of training can assist with preventing some of those problems from occurring. And again, looking at the brain and nervous system, and again, this is something here. So obviously we know that the brain and nervous system is going to be affected by aging. We know that there's benefits, particularly with exercise on the brain and nervous system. So again, if we look at the effects of aging on the nervous system, again, you have psychological issues, mental health issues. So again, poor physical self-concept, general mood disturbance, again, any type of mental health issue definitely increases with age. Decline in motor skills and performance in physical tasks. Again, so for instance, the resistance training, being stronger, particularly with your lower body, is going to help prevent falls. It'll help maintain your balance. Less accurate visual information for eye-limb coordination, hearing loss, and then desensitization of the muscle sensory system, such as the Golgi tendon organ and muscle spindles. So if you don't remember what the Golgi tendon organ is or what the muscle spindles are, make sure you review that, because that could be something that comes up on a test or a quiz as well. We know that a lot of the mental health issues that arise, they arise around various issues, both physical and cognitive. If you look at the physical discomfort from a lot of the past issues that we talked about, osteoarthritis, fibromyalgia, low back injuries, those are all things that, again, can benefit from exercise or be prevented with exercise. Exercise can also prevent or at least push off the time to Alzheimer's disease. So these are all things that exercise, related to the nervous system, has been shown to have beneficial effects on. Now, there's obviously a lot of medications that we look at here. So I'm going to talk about some of the more common ones, and a lot of these we've discussed already. So again, make note of that. Again, just to show the importance here, about 80, your book cites that about 87% of those 62 through 85 years of age take at least one prescription medicine, and often more than one physician is prescribing the medication. So, medications for older individuals, especially given the amount of medications that are out there, very common to have. There's a lot of potential for harmful interactions that you have to consider. So again, all the healthcare professionals are hopefully aware of that, but you should do that. And again, all exercise professionals should review materials, related to medication. So again, if you go back and look at some of the medications, some of the more common ones in the previous chapters, it could kind of give you some hints as to that. By now, you should be starting to recognize some medications and what they're used for. So again, there's a lot of things you have to consider from the exercise professional standpoint. Here's an example here. Medications that slow heart rate are very common. And so you may have to look at, for training intensity, you may have to go to, a physician's recommendations. So again, think of medications that slow the heart rate. You should be able to know some of them at this point. So it's very common for those. Always a good idea for older adults to keep a list of their medications to help inform decision making. And there's going to be medications that you don't recognize. Again, I've taught pharmacology in athletic training, sports medicine for a number of years. There's medications that come out that I'm unaware of. Pharmacists, and that's their job is to work with medications. They look up information all the time, but you should still have a pretty solid idea, and you should definitely recognize some of the more common ones related to certain conditions. So if we look at the effects of exercise on aerobic capacity, and again, some general information we look at, there's a general increase in aerobic capacity in response to aerobic endurance training. And again, in part, that's going to be due to improved pumping capacity of the heart. So again, performing aerobic exercise will certainly have that long-term benefit of increasing the capacity of the heart, making it function more appropriately. Again, other improvements include a lower heart rate and lower resting blood pressure, so that at rest, the heart cardiovascular system is working more efficiently and not having to work as hard. You also get benefits in maximal oxygen uptake, which again is obviously related here is the measure of your aerobic capacity. And then coupled with that, when you're dealing with things that help improve aerobic capacity, you're also going to improve your lipid profiles, you're going to reduce body fat, and you're also going to have decreased chance of type 2 diabetes, because you're going to have better glycemic control and overall better insulin sensitivity. So if we look at the effects of exercise related to muscle mass and metabolic rate, so we already talked about how lowering in metabolic rate because of a decrease in muscle mass and the health issues that could certainly cause. So again, research shows that relatively little resistance training can increase muscle mass even in older adults. So you can still increase muscle mass, and they're showing here by an average of 3 pounds. That's fairly significant. So that's something that can be very good as far as maintaining metabolism and preventing a lot of very preventable diseases. There's evidence that resistance training that causes microtrauma requires an increased metabolic rate by about 5 to 9% and lasts 72 hours after the workout. So even 72 hours after a training session, you're still kind of gaining a metabolic benefit, basically because your body's trying to recover from the resistance training. Okay, so again, you're going to have resistance training is going to increase your lean muscle mass, but it's also going to increase resting energy expenditure, which is then going to have a benefit as far as decreasing body fat and that intra-abdominal fat, which again is going to be really responsible for the insulin resistance that many older adults end up experiencing. So still looking at some muscle mass and things related to metabolic rate. So chronic resistance training also has an effect through muscle hypertrophy 6 to 8 weeks after training. And it should be noted that both resistance training and aerobic exercise result in a substantial acute increase in metabolic rate, okay, which then will contribute to weight maintenance or fat loss over time. It's also going to increase resting energy expenditure. So for each additional 1 pound of added muscle requires an additional 9 calories per day for maintenance. So again, you're increasing that resting energy expenditure, and you're increasing your body's ability to utilize energy. So again, over time, you look at substantial weight loss. So again, here we're just showing the example, 5 pounds of additional muscle. That results in an additional 45 extra calories per day, and that could translate into nearly 5 pounds of fat loss over a year. Okay, so you see how, again, you also, though, too, have to take into consideration of calorie expenditure. Again, obviously, the diet would have to coincide with this, but you see how the body becomes more efficient at using calories because of lean muscle mass. And again, if this lean muscle mass is being taken away, so say you're losing 1 pound of muscle, so then for every 1 pound of muscle, because of inactivity and being sedentary, not resistance training, now you lose that again, that 9-calorie window. So if you add that up over time, you see again the increase in body fat, the increase in the intra-abdominal fat, and how that puts people at risk for a lot of issues. So we've been talking a lot about body fat, intra-abdominal fat. Again, we know one of the metabolic issues we deal with older adults, particularly those who start to have, increases in body weight and body fat, is type 2 diabetes. So this should be noted. Again, and aerobic exercise is going to be important as well for controlling this. However, this is again where resistance training has an inherent benefit that a lot of people don't realize. So resistance training is effective at improving insulin resistance and glycemic control, and a lot of the other markers associated with this. And one of the reasons for that is through an increase in what we call glucose transporter 4 density. So what we call a GLUT4 receptor. So what a GLUT4 receptor is a receptor on the muscle that helps to basically pull glucose into the muscle for obviously for energy use. Now, what's beneficial about that, resistance training is going to increase that. So basically what that means is that a person's not going to need as much insulin to control their blood sugar as somebody who doesn't resistance train. So if you resistance train consistently as you age, that those GLUT4 receptors, they increase in density, and then therefore your body doesn't have to use as much insulin to control your blood sugar. So, again, the issue with type 2 diabetes isn't so much that your body doesn't produce insulin, it's that it doesn't know how to use it, basically because your blood sugar has stayed high because of diet and inactivity. So that's another real benefit to resistance training, is just your body's ability, if you were to sum this up, your body's ability to utilize glucose much more effectively. Now, again, obviously you have to make sure that your diet coincides with that, but certainly that's a major benefit to resistance training. That, again, while aerobic exercise, again, obviously the direct cardiovascular benefits, and again, to also assist with maintaining body fat, these are some specific items that resistance training can do to assist with this. So looking at resting blood pressure, we all know that, high blood pressure is a very common thing to have in older individuals. And again, make note of your medications. And also when you're looking at blood pressure meds, this kind of goes back to something, make sure you know how they also regulate blood pressure. But both aerobic and resistance training have been shown to reduce blood pressure. And in particular, circuit style resistance training has been shown to really help with this. So even resistance training, when performed alone and in conjunction with aerobic exercise, so either way, can reduce systolic and diastolic blood pressure. So you see here the reductions. So in general, high strength or higher levels of strength is associated with lower risk of all-cause mortality. So that's certainly something that, again, I pointed out the specific research as it relates to hip fractures, but you see even here, again, we commonly don't think of resistance training as being something that could reduce blood pressure, but it certainly has been shown to, whether that's with aerobic exercise or even performed alone. In both instances, you can see decreases in resting blood pressure. Blood lipids are another thing that there has been shown to have benefits, obviously with exercise. So again, studies of aerobic and resistance exercise show lower total cholesterol and LDL cholesterol, lower triglyceride levels, and higher HDL cholesterol levels. Again, go back to the chapter on the cardiovascular conditions, make sure you know what all of these measures mean, what it means to be high, what it means to be low, what it means to be optimal as far as all these cholesterol levels. Again, just to kind of summarize here, higher HDL levels are beneficial. Your LDL levels look to be lower. So LDL is what we, again, quote unquote, is the bad cholesterol. HDL cholesterol is what we deem the good cholesterol. So again, make sure you're aware of what all of these measures mean and how they affect the body. And again, as we've been talking about here, combining resistance training and aerobic exercise tends to yield the greatest results. Again, general cardiovascular health has been improved with even showing that resistance training on its own can be nearly as effective as aerobic training, although a combination of both is recommended. So again, here you're seeing the benefits, and a lot of people many times will do aerobic training, again, for one reason or another, which again, we'll talk about later. There's a fear of resistance training, but you see the massive health benefits associated with it, so it's certainly something that you would want to encourage with individuals. So when we look at bone mineral density, and we've talked about this before already when we've discussed osteoporosis. So resistance training has been generally shown to improve bone mineral density over time, and is very effective in certain populations. So in particular, with postmenopausal women, which we've talked about. Again, know the difference between osteopenia and osteoporosis. So osteopenia, kind of that initial loss in bone mass at the point where somebody develops osteoporosis. The bones many times at that point are starting to become a little bit more frail because you have a much larger increase in loss of bone at that point. This is also going to be associated with sarcopenia. And again, high intensity strength training could certainly help to prevent both. Your book cites a study on postmenopausal women using relatively higher strength training intensities. I think they talk about a resistance training routine using 3 sets of 8, which isn't super high intensity, but it's certainly starting to approach that. Has shown benefits in helping to improve bone mineral density. And again, that's because of the whole bone remodeling process that occurs with exercise or just with activity in general, but exercise certainly helps to enhance that. So here now we start to look at the effects of exercise just on general physical function, which again, it should be no surprise, some of this information just based on what we talk about, but again, resistance training in older adults increases strength, lean mass, and scores on functional independence measures, which again, when you look at quality of life and safety for older adults, this is a major thing to look at. And in particular, we look at improvement in movement control and walking speed. So, the improvement in movement control and walking speed for older individuals is really important. Again, it's showing general overall better function. It's also showing that, again, decreased risk of falls and the various issues associated with that. Really interesting, again, study cited they looked at 90-year-olds in nursing homes and doing one set of 8 to 12 repetitions in resistance training exercises, 2 sessions a week. In 90-year-olds, they actually found a strength gain of 60% and a 3.9 pounds of lean mass increases. So again, this shows you that even at a much older age, there's benefit to doing this. And again, as far as the best means for the cardiorespiratory system still is doing some form of aerobic endurance training, even if that entails doing like an aerobic strength training circuit, which you could certainly do as well if the person's capable of doing it. So we already kind of talked about resistance training and the need, for the benefits of the nervous system. And again, the nervous system both looks at, again, function of the neuromuscular system, but also looking at mental, psychological health. So again, the benefits of participation in resistance training includes benefits in mental health. So again, improved self-esteem, cognitive ability, reduced fatigue, anxiety, and depression. You also will have cognitive improvements. It's known that resistance training allows individuals to help with cognitive abilities and focus. Again, combining both can just provide general benefits as far as just self-concept and mood. Obviously, the less fatigued you are, typically the better you feel, and then your general overall predisposition is going to be much better. So there's certainly benefits in as far as many of the things associated with psychological and mental health. So your exercise recommendations. So we're going to be looking at a lot of physiologic things here associated with this. So many things I'm going to be discussing. Again, if terms are not sounding familiar, I'm advising that you go back. Pretty much any type of exercise physiology term or anything you would have heard by now. So if I don't explain it or don't get in depth, make sure you're aware and can distinguish it. It's obviously also going to help you retain the information a lot better. So your general resistance training recommendations are going to be found in 12.1. Again, I'm going to be discussing some things here and further on and looking. So we talk here about, the speed of movement should be controlled. Strength training should precede power training. Now, you're only going to be using slow controlled speeds if that's, again, the physiologic aims at that. You do want to, and there are benefits to power training or training through like faster, more powerful contractions. So remember, there's a difference between strength and power. So strength is just the ability to produce force. Power is kind of that force and velocity where you're not only producing force, but you're producing it very fast, which we can talk about kind of how to manipulate that. Now, again, how that gets applied to an older individual with an exercise program is going to be dependent upon their prior strength training experience, okay? So you're not going to take somebody who either hasn't trained for a long period of time or, for that matter, who has never trained and put them through, for instance, a dynamic effort squat workout. They could certainly do squats, but again, that's the type of person where you're maybe going to want to control the motion first, primarily because they may not even be proficient in the exercise. So when we kind of look at some things, I'm going to mention some things here that you could definitely take note on. Again, we look at aging factors. We had discussed some of the things that occur with age. Another aging thing that occurs is that with age, you get deterioration of your mitochondria, which is the major energy source for your cellular activity. So resistance training can increase mitochondria in skeletal muscle tissue, and that occurs with both circuit and standard resistance training. And then another benefit to that is your mitochondrial characteristics showed a modified genetic fingerprint similar to a younger individual. So basically, when they look at this, what they call modified genetic fingerprint, individuals who resistance train actually show a similar genetic fingerprint to a younger individual. So it shows the anti-aging properties related to resistance training. So in general, they recommend that older adults resistance train at least on 2 or 3 non-consecutive days a week. One set is an adequate starting point, but multiple sets in the long term do yield better results. Okay, there's various research on this topic. If you've read the chapter, which you should have by now, you've seen that there's all sorts of things saying that, oh, one set's as good as multiple, but then they show multiple in the long run are better. Bottom line is if someone's just starting out, they haven't trained in a while, they're coming off a layoff, one set could be okay, but eventually you're going to want to do multiple sets to add to that volume. If you get individuals without prior experience, using some lower intensity, higher repetition, so 40 to 60%, 10 to 15 reps is a good place to start, just so that they could help their connective tissue adapt and get used to the movements. Then as they progress, they could start to use higher intensities. So 8 to 12 reps, 70 to 80%, possibly even going heavier. And if someone has more experience, consider moving to a 4-day upper lower body split can be something that gets done as well. That's just going to give them more exposure to the movements, allow for more volume and more intensity to take place. For those that are participating in power training, again, you could use medicine balls for that. They're really good. They reduce joint stress, allow for higher speed movements. You could certainly also use dynamic effort strength work for that as well. All exercises, for the most part, or the person should at the very least be given an opportunity to use full range of motion. There are some times where, again, some partial range of motion stuff could come in. I'll make mention of that in class a little bit more. If I forget to, remind me to do that. Just watch your Valsalva maneuver with these individuals, just because, again, it could impede some venous return and produce some cardiovascular, some negative cardiovascular effects, dizziness and blacking out. I would say in particular, you're going to use, going back to my point on partial range of motion, if an individual is doing some heavier resistance training, it's not a bad idea to rotate in some partial range of motion movements, just because that'll further, help with the nervous system and at least, kind of change the joint stresses a little bit, but certainly you would want many of your motions to go through complete range of motion. If you're starting to work towards muscular power, around 60% of a 1 repetition max tends to be that transition from more power development to strength. Again, that's something that varies a little bit with different resources that you look at. So basically 60%, less than 60%, you'd be looking more at power training because that maintains the speed of the movement. Going over 60%, now you're starting to work more strength, because obviously the barbell is going to slow down because the weight begins to get a little bit heavier. Okay, so looking at other exercise recommendations, again, refer to table 12.2. I'm going to discuss some things here just to kind of highlight some general recommendations as far as timing. Again, 5 or more days per week, and you see the accumulated kind of volume time-wise, either 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity exercise. And ideally here, you can utilize your rating of perceived exertion. So again, you should have an idea of the ratings of perceived exertion and what that means as far as the different levels. So a 5 or a 6 on a 10-point scale is moderate. Vigorous is, it would be a 7 or an 8. Again, large muscle, rhythmic, weight-bearing activities should be utilized. Again, a very simple one is just, fast walking could be a benefit to a lot of individuals. Again, we had talked about the benefits of getting multiple steps in a day, but certainly higher intensity exercise for somebody where it's more appropriate will certainly elicit some benefits as well. So you want to make sure to be including that as a part of their exercise. So again, we've been kind of going on about obviously the benefits of resistance training, but again, certainly aerobic cardiovascular training certainly still has a benefit for all individuals. Again, getting that large muscle aerobic activity most days of the week. And again, the other thing you could also use is percent of max heart rate. 60 to 80% or 60 to 90% of age predicted max heart rate kind of gives you your range, and then obviously looking at moderate intensity being about 40 to 60%, or 40 to a little less than 60%, greater than or equal to 60 to 90%, you start to get into more vigorous activity. So again, doing something most days of the week, again, even if some of that is just walking, there's certainly a benefit to that. They also kind of talk about various durations and things like that. So again, make sure to be mindful of that as you've gone through the reading, in addition to kind of looking at those general tables that look at the recommendations. But at this point, a lot of the recommendations are very similar. Just kind of make note of any unique circumstances for that. So looking at strategy, so again, many times a lot of this comes into, kind of getting people to want to do the exercise, instructing them on things. There's certainly things you want to look at. Again, in motivating, sometimes older adults can be challenging. Again, if you get somebody who has exercised in the past or has been consistently training, it's obviously much easier, but less than 5% of adults over 50 years old regularly engage in moderate intensity exercise. And that's actually a fairly alarming statistic, particularly when you look at a lot of current health concerns of the issues there. Now, many of the individuals, part of the reason why they don't do this is, again, they kind of get worried about exercise actually causing problems. So, they have concerns that, well, they're going to, cause abnormal stress to their heart or injuring their muscles. So I think, a good way your book gives the strategy of using a two-step strategy to kind of calm their fears. One is explain the physiological benefits. Okay, so I think explaining the benefits. So, they may be worried about injuring their joints or injuring their muscles, but again, kind of the long term, again, decrease in muscle mass and the decrease in strength, they're going to put themselves at risk for injuring their joints one way or another. So again, instructing them that, safe resistance training, safe cardiovascular training certainly has physiologic benefits and can possibly prevent a lot of diseases. And also use specific interactive training strategies geared towards this population. So again, look at instruction, look at good instructional strategies and things like that are more effective in helping older adults gain confidence in how they perform exercise and just even in the confidence. So confidence in performing the exercise, confidence in being able to carry out the program. So we'll talk about, again, some of the specific things as it relates to instructing. So that's the kind of the second part of this two-step strategy. We're going to look at some points relative to instructing them on exercise performance. So here are some relating to those specific strategies. So understandable performance objectives. So this is something that, again, you begin each exercise session with a desired performance objective. Okay, so whatever that may be. So performing exercise through a full range of pain-free movement, even if it's something as simple as that. So that, again, that's going to help them in kind of gaining confidence in what they do. Concise instruction with precise demonstration. So exercise instruction should always be coupled with exercise demonstration. So again, this is why it's important that you as the exercise professional are very competent in performing the strategy, particularly if individuals are visual learners. Attentive supervision, so actively observing them while they do it. Okay, giving them, immediately detect, correct any errors. And sometimes, particularly when you're talking a more complex exercise, sometimes it's better to maybe really hone in on one or two things at a time instead of, throwing a bunch of different corrective things at them, So kind of fix the more obvious things first and then kind of go back and maybe some of the little, nitpickier type things, kind of hit that up once they, kind of start to develop better, ability to kind of just perform the general movement. Appropriate assistance. So again, guiding an older adult through a proper movement pattern, particularly when they're using, particularly with resistance training. So again, kind of giving them some feedback, even tactile feedback and helping guide them, particularly if they are much older, can certainly help. Even some tactile feedback with muscle action could certainly be a benefit. Again, one task at a time. So again, this kind of where it comes back to even with when you look at performing an exercise, if you focus on one thing at a time or one major error, it could be something that, kind of allows people to kind of improve themselves and kind of gain confidence instead of trying to think of a bunch of things at one time. Gradual progression. So again, older adults should begin with a few basic exercise and then add new exercise once they've mastered the previous one. So you're only going to add new exercises frequently if you get somebody with, that has a lot of experience. So, I mean, again, if you're dealing with a, former power lifter or something like that who, is just kind of looking for some guidance for, they have some pain and things like that. They're looking for some new ideas. Those individuals you can kind of usually give newer exercises a lot faster to, obviously. Positive reinforcement, again, particularly with older individuals, and older individuals who don't have as much experience, they're not going to have confidence. And I think, just personally, I think that's what inhibits a lot of people from doing resistance training. It's this nervousness to do it. But I think certainly regular encouragement can definitely help with that and allow them to carry out. And then they'll start to gain more confidence. So, the more they start to do things, resistance training, has been shown to improve just general confidence in all ages. And certainly older adults, it would be no different. Giving specific feedback, so a combination of positive reinforcement and specific feedback, again, both motivationally and educationally can be beneficial. Again, and this isn't something that is again per se just unique to older adults. I mean, you could even see this with younger adults. Just giving them little things like if they're squatting, you really are utilizing your hips better to squat. You're sitting back more. You seem like you're keeping your posture better during, whatever exercise. When you deadlift, you're definitely driving with your hips more. Little things like that kind of gives them the idea that they're getting better at the exercises, and again, just increases their confidence. Again, careful questioning. So many times older adults, they may not voluntarily provide information as to how they feel when engaged in resistance training. And you may see this particularly in individuals. I think this is where, when it comes to injury issues, particularly with people who have been training, they may kind of hide things because they don't want you to, scale back their program. So again, it's not always beginners that are always going to have these issues and where you need to be careful with this. It could also be in, you get that 62-year-old who, has been training for a long period of time, and they still want to train hard, but they realize they got to watch because maybe they have some lingering injuries. They may not share that information. So again, you got to watch just your questioning, whether it's, again, beginner or advanced person. And then pre and post exercise dialogue. So again, some dialogue at the beginning and at the completion just to kind of see where people are at. Again, older adults are usually going to appreciate that. Kind of seeing how they felt. How did you feel with the workout? If you did a new exercise or you used, more weight, or maybe you had them do like for more power, you decrease the intensity, but you wanted them to do faster muscle contraction. How did that feel? Getting an idea for how they kind of progress through that. And again, the entry conversation may emphasize encouragement for attaining the workout objective. So again, that may kind of motivate them to kind of proceed and do well. And then the exit conversation could just, again, reinforce the exercise performance, allow them to, feel what they've accomplished in the actual training program. And again, here are your learning outcomes. So again, go through your learning outcomes. Again, make sure, as I've been saying all along, review some of the common medications. We didn't get deep into medications here, but some of the things we discussed could kind of hopefully bring back some things. If you're not up on, say, for instance, your blood pressure meds and how they work, go back and review that. Would certainly be beneficial. Again, any type of, whether it's exercise physiology term or, anatomy-based term, make sure you kind of review those concepts as they would have been covered elsewhere as well.